Today we have Blue, and Blue is an 11 weeks old puppy. She's a female. She's still intact, as she should be at this age. And she's here today for a fear-free visit. So we're going to do this very low-stress handling. We try to offer puppy packages for, first-time vaccine appointments or just wellness exams, where they get like a positive interaction with us, with our staff. The owner is also present. Marissa is here to give her emotional support. And then what we want to do with this appointment is show them all the things that are involved in an exam or in a vet's visit that normally they would be afraid of or scared. But here today, since she's a naive puppy, she has not been sensitized to these things yet. So it's an opportunity to show her that coming to the vet is actually a good thing. She's gonna get treats, she's gonna get petted, everything will be voluntary, we're not forcing her to do anything. And then the next time when she comes in for a real vaccine, then she's already gonna be familiar with everything that we have. So we have toys here, we have a thermometer that doesn't mean anything to her, she's not terrified of it yet. We have a nail trimmer. So all these things are here for her to actually sniff, have an opportunity to interact with these things here. And they're all novel to her. They don't mean anything scary or painful or aversive. And we have toys for her as well that she can bite onto. And we have a clicker. So we're gonna start introducing her to clicker training today. Blue, look what I have. I have food. So she's gonna get treats today. Now we're gonna introduce her to basic training. So with the clicker here, what we're doing is teaching her that when she hears this sound, that means food is coming her way. So it's all positive. And introducing them early to clicker training will facilitate training in the future so she can learn pretty much any behavior that we want her to learn. Do you know sit? Mm-hmm. You do. Blue, can you sit? Can you see? So I'm trying to kind of work with her and lure her into sitting here. So as soon as I saw her butt touching the floor, I clicked and then I rewarded her. Now she's already sitting. Can you sit? And sit is something that she already learned before, so we're trying to reinforce it now. Trying to make her work for that food instead of giving it to her for free. Ooh, can you sit? Good job. And now you dropped it. So one of the things that we want to also do during this appointment here, not just let her have an opportunity to play with things, but introduce her to things such as a muzzle. Hopefully she will never need a muzzle in the future, but if she ever does, I don't want the muzzle to be something punishing for her. So I want her to have seen this before, associated this with something good. The way we can do that is by giving her a treat through the muzzle, like that. So we kind of make her put her head inside and get the treat by putting her head inside. Then this way, the muzzle will never be something aversive if she ever has to wear it. Blue, do you want a treat? Good job. And when we're doing these puppy visits, they normally, any dog, no dog actually likes to be put on top of a table. So that's one of the scariest parts of the visit is actually putting them on top of a high, tall table. So what we like to do with all of our appointments, if possible, to do them all on the floor where they are more comfortable. So with the puppies just sitting on the floor, you can put towels if you want, to just protect them from the environment. We try to keep it very clean so they don't get exposed to diseases. But we don't want to make them restrained for too long. Puppies don't like to be held and restrained for more than just a second or two. So what we do here as part of the desensitization is to actually do something to her, such as hold, restrain for just a second or two, and then let her go. So progressively, she's going to be restrained for longer because at a certain point, we're going to have to hold her and actually give her an injection in the future, in the next visit. So we're kind of prepping her already for that. And she can go back, play With the owner, we can redirect her biting behavior, which is just play biting at this point, but we can redirect it to a toy, like that, a chew toy or a rubber toy. There we go. And while we're doing that, we can take an opportunity to take a look at her eyes, since we have a toy in our hands here, and then let her go. What we don't want to do is hold them for too long, restrain for too long. So I'm trying to do a physical here with her while we're playing, so she doesn't know that I'm doing a physical, because for her, this is just a fun interaction. So now I'm looking at her ears. They look good, nothing there. And then we go back to playing. So the order of events here during this appointment is going to be a little bit different. We want to do things as she allows us to do it. So this becomes like a voluntary activity. Lou, look, I have toys. Yeah, let me see. Can I see your mouth? Oh, that's a beautiful mouth. Come here, come. Oh, look, I have food for you. How about I look at your mouth while you're eating food? There we go. Good job. So while she's munching on a treat here, I take an opportunity to take a look at her teeth without making this a terrifying experience for her. Now, how about you come over here? And then Mom is going to keep you distracted with a toy, and I'm going to listen to her heart. Or maybe Mom can give her a few kibbles and keep her entertained with the food.
Oh, she likes you.
So what we're going to try to teach her here, this is a great opportunity, is that handling means food. No handling means no food. So if I'm not examining her, there's no food. If I am examining her, then we give her food.
Yeah.
We give her treats. That gives me an opportunity to be able to do a good auscultation here while she's distracted with something else, and she will learn pretty fast here that when we're doing something to her like this, it's not supposed to be aversive or painful, because it isn't, or scary. It's supposed to be fun, because when she comes here, she gets food, so it's all good. Everybody wins, right? So we were able to auscultate without her being too aware of it. She noticed that I was doing something, but it doesn't hurt. It's not scary. Mom is here. Mom is giving her food, so it's all good for now. Now what we're going to do is, oh, go get it.
Good job. Thank you.
Good job, Blue. So now I'm going to try to palpate her. So I'm going to grab her over here. Mom is distracting her, and I am palpating her belly. Maybe I'm not going to be able to palpate everything in one attempt, but I'm going to try.
Blue.
While she's getting something yummy. And she's also getting a belly massage today. So we don't call this palpation, we call this belly massage, right? And it all feels pretty good. She's not tense at all. I can actually dig my hand all the way in there, feel her bladder, which means we need to pee soon here. So she didn't even realize what I was doing. So this is all part of playing for her, not a palpation, a scary physical exam, right? The one thing that we're not going to do today is temperature taking. So this is just a wellness visit. She's not having any symptoms of disease, so I don't really have a reason to put this thermometer in there and get a number. Next time, maybe for her vaccine, we're going to do that, but then Mom is going to learn how to do temperature taking desensitization, which is one of the videos we prepared. so that that can actually be done at home and we don't have to make that part of a scary visit for her, because this is actually the second part that they hate the most. So being put up on the table and then having the temperature taken, those are the two most terrifying things or procedures out of the entire physical exam. So by the time we get to do the vaccines, they're already afraid, they're already scared, they are overreactive already, and then everything else becomes more difficult and more aversive to them. So we don't want to make that happen. We want them to leave like this, playing. This is a fun experience, right, Blue?
Yes, I would say so.
We're going to check her joints. Yes, keep playing with that toy. I just want to feel your shoulders a little bit. So it's much easier to hold onto them like that while they're playing and distracted with something else than to try to heavily restrain them. So this is how we want to end this wellness visit today. She's not going to have anything else done to her. She came here to play with us. That's pretty much the impression we want to give. Blue, do you want to come here? Got this toy? Yes? And this is how we do our puppy appointments, our first time visit, and the next time she comes in and she sees this setup here, she's going to remember that this was a positive experience for her, and things should be easier with time. Every time she comes in, it's going to be easier and easier. And then at a certain point, we're going to need to give her an injection, but we're going to do exactly what we did here today. We're going to put her in a playful, happy mode, give her the injection, and then also end the appointment in a happy, high-tone vibe. So that's what we want to do for them. Good job, Blue.